Hi, I'm Dr. Michael Chen-Illamos. I'm a family medicine physician, and I'm the Associate Medical Director here at Ossining Open Door. I'm also the PrEP champion for Open Door. So that basically means that I'm all about talking about PrEP with my patients, with other clinicians here at Open Door, and making sure that a lot of people know about PrEP and why it's so important that patients should be offered PrEP and know about it in the community. Okay, so PrEP. PrEP stands for pre-exposure prophylaxis. It's basically a medication that's taken every day to prevent HIV. And the medication, when taken every day, is up to 99% effective, which is completely awesome. This is a safe medication. It's FDA approved for patients that want to protect themselves from HIV. It's really important that the patient who's starting the medication is HIV negative, and that's why we monitor regularly. The most common side effects can include like nausea and vomiting or a GI upset or stomach upset, but the majority of the patients that I take care of don't have these symptoms, but we let patients know that anyway, just because of the fact that any and all medications have side effects, but obviously the benefits of this medication completely outweigh the risks. So PrEP is a medication that if you want to protect yourself from HIV and you're HIV negative and you want that level of protection, then PrEP may be a medication that you want to consider. And this medication is for any adolescent or adult that wants to protect themselves from HIV. It's FDA approved, it's a safe medication, and it's monitored by a clinician every 3 months. Essentially, if you've ever had a sexually transmitted infection or like gonorrhea, chlamydia, trichomonas, syphilis, or herpes, any of those infections could increase a patient's risk of getting HIV in their lifetime. So we know that having a conversation with your clinician about whether or not PrEP may be something you want to consider is a great thing for you. Obviously, we follow every 3 months and we monitor for kidney health and liver health with the medication. So for the majority of patients that are otherwise healthy, this medication is completely helpful for them and doesn't cause side effects. For any other patients that have other chronic medical issues, it's really good to talk with your primary care clinician about managing and starting PrEP. Any patient who wants to protect themselves from HIV should consider being on this medication. I'm really passionate about HIV prevention and protecting patients in the community from HIV. And what we know is that it's 2020, things have changed, and we have better ways of preventing HIV and also for screening for HIV and other sexually transmitted infections. The majority of the patients that see me from the community are coming in to get checked for gonorrhea and chlamydia and other sexually transmitted infections. And the majority of patients that come to see a clinician to get checked may not have any symptoms whatsoever. And that's why it's so important to see a clinician regularly, part of the comprehensive care teams that we have here at Open Door, and to really think about whether or not HIV prevention by using PrEP is good for them, and it fits into their day-to-day life. It's an extra layer of insurance, and this is part of your comprehensive sexual health. And I know that many patients don't like to talk about sex with their patients, or clinicians are uncomfortable with talking about sex with their patients. But in order to have this level of protection, in order to have an honest dialogue, you really need to have this conversation with your doctor or your clinician that you're seeing. It's really important because your sexual health is part of your health, and it's part of that overwhelming thing that we call wellness. So personally for me, prescribing PrEP and talking about PrEP and providing education and resources for my patients to keep them healthy has been really, really important to me. One of my goals as a doctor is basically to keep people healthy. And that is not just limited to just their heart health and their diabetes and their blood pressure, but it's also about their sexual health. And that is a major, major part of wellness. It's a major part of the human body. And for me, I'd like to be able to give myself and my patients something that I can actually do to help them keep themselves safe. And PrEP has allowed me to do that. PrEP has now allowed me to give something to my patients to keep them healthy all throughout their lifetime, and also allows me to ask and answer a lot of questions that they may have I think it's important. I think it's really important for all patients to have a primary care clinician that you feel that you can have a conversation about your sexual health. And there are many patients that I take care of that at first were really undecisive about whether or not they wanted to be on PrEP, and they didn't know that much about it, or they had a lot of concerns. And that's okay. That's what we're here for. I'm here for that, and we're here for that at Open Door. And we hope to see you soon.